This is part 3, carrier screening for genetic disorders and principles of dysmorphology and common syndromes. I'd like to do a review of critical periods for just a moment. Remember that genetic abnormalities as well as exposure to certain toxins, radiation, and infections can cause congenital anomalies in the embryo or fetus. The time in which an embryo is most vulnerable to malformations caused by teratogens is during the first 8 weeks of development. Let's also remember that the term teratogen comes from the Greek meaning monster former, meaning this is causing birth defects. The vulnerable periods of development are called the critical periods, and some organs, such as the brain, are sensitive throughout fetal development. This slide is showing you those systems that are affected at specific periods during the development. There are 4 classifications of congenital anomalies: malformation, disruption, deformation, and dysplasia. If we look at malformation, it's a structural defect of an organ or larger body region. It can result from abnormal embryonic development, such as a chromosomal abnormality of the gamete at fertilization. A disruption is an interruption of a normal developmental process. A disruption cannot be inherited. A deformation is an alteration in form or shape resulting from mechanical forces and occurs in an otherwise healthy tissue. Dysplasia is abnormal development of tissue that often affects several organs. Birth defects are the leading cause of infant death, causing more than 20,000 of all infant deaths. Approximately 1 in every 33 babies, about 3%, is born with a birth defect. The causes of the congenital anomalies are genetic or environmental or a combination known as multifactorial or polygenic inheritance. If we look at the genetic factors, which we've already covered, we have the causes being aneuploidy or structural chromosomal abnormalities such as deletions, inversion, translocation. If we look at environmental factors, we have rubella virus, also known as the German measles virus, cytomegalovirus, CMV, toxoplasmosis, herpes simplex virus, syphilis caused by a bacteria, human immunodeficiency virus, drugs, alcohol, ionizing radiation, heavy metals, bisphenol A, BPA, and illicit drugs. In 1964, a Time magazine article encouraged rubella parties, even recommending strategies so that especially all the little girls get the infection. Unfortunately, despite warnings about keeping infected children away from pregnant women, nearly 50,000 women in vulnerable stages of their pregnancies were infected with rubella during the outbreak, leading to thousands of miscarriages, even more children being born with severe damage. At least 8,000 babies were born deaf, 3,500 deaf and blind, and the total number of congenital rubella syndrome cases reached 20,000. Over the course of the outbreak, the country tallied approximately 12.5 million cases of rubella and more than 2,000 deaths, resulting medical costs reached the billions. During this time period, I was a child in school. I did not know that I had rubella until years later when I was hired for my first job as a genetic counselor. I had no idea, and that's one of the things about this disease which was so frightening, is that most people who had it were asymptomatic, and we were walking around and we were actually infecting others. We did not have the vaccine until 1969. Today, you can get the vaccine as part of the MMR, or you can have it bundled together with the MMRV for the varicella, which is the chicken pox. Cytomegalovirus or CMV, is a common virus that infects people of all ages. In the United States, nearly 1 in 3 children are already infected with CMV by the age of 5 years. Over half of adults by age 40 have been infected with CMV. Once CMV is in the person's body, it stays there for life and cannot reactivate. A person can also be reinfected with a different strain of the virus, however. Babies born with CMV can have brain, liver, spleen, lung, and growth problems. A hearing loss is the most common health problem in babies born with congenital CMV infection, which may be detected soon after birth or may develop later in childhood. Toxoplasmosis is caused by a protozoan called Toxoplasma gondii. It's caused by eating raw or undercooked meat, handling soil or cat litter contaminated with feces of infected cats, or by cleaning bird cages. Having a primary infection in pregnancy may produce no symptoms for the mother, but it can cause congenital toxoplasmosis. In the fetus, the effects are intracranial calcifications, chorioretinitis, microcephaly, microphthalmia, hydrocephalus, and seizures. The main thing to remember from this is that a pregnant woman should never empty the kitty litter. Herpes simplex virus, HSV, is the most common sexually transmitted disease among adult women and is transmitted across broken skin and mucous membranes by direct exposure to the skin. At the primary onset of HSV during the late pregnancy carries a 30% to 50% risk of neonatal infection. If a baby has a neonatal infection, there is a mortality rate of 50%. Women who have had HSV usually choose to have a C-section for delivery of their baby. The infection causes chorioretinitis, hepatomegaly, thrombocytopenia, hemolytic anemia, and mental retardation. Syphilis is caused by a spirochete, which is a bacteria. This organism can cross the placenta as early as 9 to 10 weeks gestation. The primary infection acquired during pregnancy can later cause serious congenital anomalies or stillbirth. Congenital syphilis is classified as early or late. If you start to manifest it during the first 3 months of life, there are lesions on the skin, lymphadenopathy, hepatosplenomegaly, and a nasal discharge. If you start to manifest it later, there are ulcers, optic atrophy, bossing of the frontal and parietal bones, deafness, and corneal scarring. There is also a problem with the heart. The torch panel test is used to help diagnose infections that could harm the fetus during pregnancy. So you may be hearing about pregnant women having the torch test, or you may be hearing about newborns that are suspected to have specific infections, or if they're ruling out infections, to be getting this panel test. And when we look at it, the TORCH is an acronym of the five infections covered in the screening. The T for toxoplasmosis, other including syphilis for other viruses, rubella, cytomegalovirus, and herpes simplex virus. We will be looking at anomalies in much more detail in the next course in the spring, and we will come back to this.